That the evidence I shall give
shall be the truth,
the whole truth,
and nothing but the truth.
I think that the toxic culture that you've seen at the centre of government, that's been subject of much discussion, was unhelpful in assuming that when anything was difficult or a challenge, therefore there was somehow fault and blame. That is a part of the toxic culture that we've seen. Systems need to be in place so that if there is a malign actor in number 10...
Do you mean Mr Cummings?
Well, in this case, that was the example, but there may be in the future. But if there are people whose behaviour is unprofessional, the system needs to be able to work despite that.
Important government advisors and officials have concluded that the Secretary of State for Health, in the maw of this public health crisis, in the maw of the beast, was a liar.
Well, I was not. You will note that there's no evidence from anybody who I worked with in the department or the health system who supported those false allegations.
So I am required to ask you, how sure are you that you told the Prime Minister that he had to call for an immediate lockdown in a call on the 13th of March?
I can remember it, and it came to light in looking forward to this inquiry.
My view is a ring is a circle without a break in it. However you describe the protective processes you put in place around the care sector, they did not form an unbroken circle, did they?
It is quite clear from the evidence that Professor Van Tam is right.
Yeah, thank you.
If at that moment we'd realised that it was definitely coming and the reasonable worst case scenario was as awful as it was, that is the moment that we should, with hindsight, have acted. And if we'd had the doctrine that I propose, which is as soon as you know you've got a lockdown, you lock down as soon as possible, then we would have got the lockdown done over that weekend, in on the 2nd of March, 3 weeks earlier than before. There's a doubling rate at this point, estimated every 3 to 4 days. We would have been 6 doublings ahead of where we were, which means that fewer than a tenth of the number of people would have died in the first wave.